Hello friends, my name is Ilya Artyumenko. Today we will talk about a very common problem, namely lower back pain. In fact, usually the lumbar region is not to blame here. The pain originates in the sacroiliac joint, which is located right here. It usually occurs in vertical positions and in sitting positions. It can also bother you when you get up from a chair or transition from a horizontal to a vertical position. It also never rises above the sacroiliac joint. It spreads to the leg but never drops below the knee. People with such a problem often find it uncomfortable to walk for a long time, sit for a long time, and so on. And today we will look at exercises that can help you cope with this. But first, the tests. As I've already said, this pain arises in the area of the sacroiliac joint. Usually, it's only on one side, either on the right or on the left. To confirm whether you need the set of exercises I suggested or not, we need to perform two tests. Stand straight, put your hands on your hips and lean back in the lumbar region without using your knees. If your symptom appeared either on the right or on the left, then the set of exercises I suggested is shown to you. This is also checked by leaning to the side opposite from the pain. If it hurts on the right side, we lean to the left, and you should also feel a slight increase in pain. So let's start performing a set of exercises with a little self-massage. For this, we will need a foam roller and a massage ball. I talked more about myofascial release techniques in one of the previous videos. We need to work with the front surface of the thigh. Specifically, as a rule, this is the upper third of the thigh. Well, if you roll the entire thigh, it won't be superfluous. And with the help of a ball, you need to work with the middle gluteal muscle. The thing is that a similar symptom arises because one wing of the pelvis is slightly tilted forward. And the muscles that stabilize this segment are very tense. And before the complex, we need to relax them a little. We take a roll and pay a lot of attention to the muscles of the upper third of the thigh. We lie down and start rolling. It's very important to add a little rotation to the roll in order to find the most tense areas. As soon as you find something most unpleasant, and as a rule for people with a similar symptom, the area is located here closer to the sacrum. We lie down and wait until it relaxes a bit. To increase the pressure, you can leave only one point of support. If it's very painful, on the contrary, add an additional support point and the pressure will decrease. It's necessary to roll from 40 seconds to 1.5 minutes, but I would recommend focusing specifically on the feeling. As soon as the unpleasant feelings start to fade away, they won't completely go away, but will start to lessen, and you can gradually move to another area. Over time, the pain will occur less and less during this procedure. Next, we take a massage ball and sit on it with the area of the gluteus medius muscle. The idea is absolutely the same. The fewer support points, the higher the pressure you can help yourself with your hands and control the level of pressure. If it's very painful to roll like this, and at first it probably will be quite unpleasant, you can lower yourself onto your elbows. Lower yourself onto your back. If even in this position it causes very strong discomfort, you can avoid throwing your leg. We also roll from 40 seconds to a minute and a half, but it's better to focus on feelings. During this technique, unpleasant sensations may occur on the surface, on the outside of the thigh. There's no need to be scared. It's absolutely normal. And despite the pain arising from one side, I would recommend performing these actions on both sides. For the next exercise, we will need a yoga block. However, this is not mandatory. If you have a foam roller, that can be used. If you don't have either, a thick book wrapped in a towel will also do. We lie on our back. The angle of bending at the knee joint is 90 degrees. We put the block with the wide side between the thighs. It's quite gentle, but gradually increasing the intensity, we start to squeeze it. The intensity needs to be increased to the maximum possible force during the execution of this exercise. There may be a strong pinch, but it will not be painful. Don't be scared, it's just the pubic symphysis pulping. And so, we perform 6 to 8 times. We're giving in and relaxing. We're giving in and relaxing. Each repetition we do for 5 to 6 seconds. And I repeat again, not sharply. If this exercise causes you severe pain, do not perform it. It is contraindicated for you. We did 6 to 8 times. Put the stops together. The corner remained the same cube. We turn it over with a flat side and also put it there and start to squeeze. We squeeze, we relax, we squeeze. We relax 6 to 8 times for 3 to 6 seconds. For the next time, for 3 to 6 seconds for the next one. We will need a stool for the exercises. And this is the only exercise that needs to be done on one side only. We put the foot on the stool from the side of the pain. The angle in the knee joint should be approximately 90 degrees and you should feel a good resistance with your heel. You can put your hands in front of you for understanding and slightly turn your body towards the supporting leg, that is, towards the side opposite the pain. And from here we start to lean as if we are pulling the left buttock towards the left knee. We lean, we reach the limit of tension. You can try to push it a little bit further and gently return to the starting position. Perform such 10 times. The effort should be intense enough, but it needs to be done smoothly. Mistakes can be made in this exercise and they happen quite often. They look like this. When people start to lean, they don't lean forward but push their pelvis back, thereby bending the knee joint. The knee remains in the same position as it was from the starting position. So we lean down, and when you lean your body, you should feel a good resistance with your heel. Reach the hard limit, try to push it back a bit and return to the starting position. We perform 10 such repetitions. During the execution of this exercise, you will feel the stretch of the muscles of the back surface of the thigh, the stretch of the leading muscle group, possibly some stretch in the area of the cross. This is normal. There should be no sharp pain during this exercise. And I repeat, this exercise should only be performed on the side that is bothering you with pain. For the next exercise, we will need a rubber ring expander. This exercise is necessary for us to develop control over the end amplitude of the thigh flexion. This is not a strength exercise. This exercise is more about a person learning to feel this part of the amplitude. And for this, we will need a band not of strong tension, but the tension should be noticeable. From the side of the pain, we put the band on the middle of the thigh. The pelvis is in a horizontal position parallel to the floor. Pay attention to the rotations. They should not be allowed. Also, lateral tilt should not be allowed. The supporting leg, the front one, that is, we stand on the front leg, the back leg is bent. If you have the opportunity to lean your hand against the wall, that's great. Do so. We put the free hand on the hip. We need this for additional tactile contact, so that more signals from this region go to the brain. So from this position, I repeat, the supporting leg is forward, we begin. Bend the knee and strain the buttock. Extend the knee and independently strain the buttock at the end of the amplitude. It is necessary to ensure that the lumbar section does not overextend. If you see any such movements in the waist, they are unnecessary. The spine should be rigid and fixed, and the hip moves relative to the stable torso. One more time. We bend, we strain the buttock. We bend, we strain. Let me repeat once more. This is not a strength exercise, and the band is only needed here to slightly intensify this direction to better feel this region. This exercise can be done both for the healthy side. It won't be superfluous, but it's not mandatory. 15 such repetitions. You stretched, strained the gluteal muscle, held for a second and a half, and returned to the starting position. Stretched, strained the gluteal muscle, and returned to the starting position. You should feel the tension of the gluteal muscle. And I repeat, it is strained, not only because it resists the rubber band, additionally strain it independently. Most likely the gluteal muscle will start to feel not from the first, and even not from the second, and not from the third repetition, but somewhere to the repetition to the 10th. If the tension in the gluteal muscle is still not felt, probably you took a slightly incorrect starting position. Try to take the starting position and tilt the body slightly forward. To shift the weight of the body to the supporting leg, that is, the main part of the mass of your body will be on the supporting leg. And from here we start to bend the hip. The next exercise is for the development of the middle gluteal muscle. For this, we will need a short loop band and a wall. Such bands are usually sold in sets from the lightest to the heaviest. Choose a level of tension that you can handle. And despite the visual simplicity of this exercise, it can be quite difficult in the early stages. And we place the band slightly above the knee, lie down with our back to the wall, press our head against the arm that is down. We always start the exercise from the side we are working on. That is, our working side will be the upper one in this position. We place the free hand in the projection of the middle gluteal muscle. We need this for an additional tactile contact, and accordingly more signal from this region will go to the brain. It will be easier for you to feel this muscle. The toes are not pressed, but also not detached from the wall. The cross is pressed, and this is important. From this position, we slowly start to perform the leg extension. We perform 10 to 12 times. You should feel the tension under your upper arm. If you feel a strong tension in this area, or on the opposite side of the hip, strain your abdomen more. So let's repeat one more time. The fingertips touch the wall, the cross is pressed, the chest department is pressed, the head lies, the free hand lies on the buttock. Tense your stomach and perform the leg extension. 10 to 12 times, 2 approaches on each side, starting from the side of the affected area. The amplitude of the thigh abduction should be such that the sacrum at the top point does not tear off. Do not try to touch the wall with the knee of the upper leg. There is no such amplitude in the hip joint, and without compensation, do not touch the wall. Here we need a stable, non-moving pelvis and a leg that moves relative to the stable pelvis. Lifted, you feel that it doesn't go further, and lowered down. Lifted, nothing moves except the working leg. And I repeat, choose the optimal load, and the stretch should be such that you can handle. Do not force, not with events, and do not take heavy rubber bands at once and the last exercise. From our complex, this is a one-legged berry bridge. To perform this exercise, you need to lie on your back, pull your legs to your buttocks, take one leg in your hands. The supporting leg is on the side of the pane. We clasp our hands and wrap around the shin. The exercise looks like this. We lift the weight, lower it down. We do it 10 times, but it's not that simple. Grab the ankle. When lifting the pelvis, the opposite side should not sag, so the muscles we are training during the entire amplitude of movement will not be overloaded. Try to control the horizontal position of the pelvis. That is, the pelvis should be parallel to the floor. The gluteal muscle should be strained. If you feel tension in the front surface of the thigh, the back surface of the thigh, or the lower back, try to strain the press harder during the execution of this exercise. So we perform lifts of the pelvis 10 times. The foot presses the heel into the floor. And if you follow all these parameters, your gluteal muscle will work. We did it 10 times, and we stand in static for 30 seconds, just holding the position. If in a static position, the lower back or the back of the thigh starts to strain heavily, try to come out of the edge of the amplitude, lowering the pelvis a little lower and more, and press the heel into the floor. Possibly, in such a position, the gluteus will engage better. As soon as you felt the work of the gluteus muscle, try to lift the pelvis a little higher with its help. And hold the position for 30 seconds. And we perform this exercise on each side for 2 approaches. 10 repetitions, 30 seconds of statics. This problem most often arises due to imbalance of musculature and gluteal muscles. Therefore, we need to train both the side that hurts and the healthy side in order for them to be balanced. So, we have looked at a set of exercises against pain in the sacroiliac joint. Perform this set of exercises twice a day for 3 weeks. If you feel that you need to rest, your muscles are tired, or your level of physical fitness does not allow you to perform every day, or this does not allow your life tempo rhythm, nothing terrible if you miss one day. But it is recommended to perform this set of exercises for 3 weeks. And even if the pain stopped bothering you a week after performing the set, please force yourself to complete all 3 weeks at least once a day, because it will be an excellent prevention of recurrence. If during the performance of any exercise the pain sharply becomes more acute, or after 3 weeks it got better but not completely gone, I would definitely recommend seeing a specialist to see if there are any other components, or if something in the exercises you performed was incorrect. Thank you for your attention. Stay healthy. Lead an active lifestyle. This was Ilya Artemenko. Goodbye. To be continued.